Welcome back to the World Cancer Leaders Summit. We now have an interview with Garth Graham, an American cardiologist, researcher and public health expert. Garth Graham has joined Google as Director and Global Head of Healthcare and Public Health Partnerships at YouTube and Google Health. Quite the title there. Dr. Graham talked to me about the potential of big data and cancer.
Well, joining me now for the World Cancer Leaders Summit is Dr. Garth Graham, who is Director and Global Head of Healthcare, I should say, and Public Health at Google, and also Head of YouTube Health. Dr. Graham, it's wonderful to see you. Thank you for joining us.
Thank you for having me, Hannah.
Now, you provide medical and scientific advice across Google's products and services. Just explain to us what those products and services actually are then.
Yeah, there's a broader health team of which we're a part of. And, we work, the broader health team works across, the broader Google Health team works across Google. They work with search, which is, the traditional Google search that most people are used to. I specifically work within YouTube. And we work to really elevate health information, get quality health information in YouTube. There are other parts of Google. There's Google Cloud that looks at, how you aggregate data in the cloud and make it beneficial for patients' health. So there are a number of healthcare leaders working across Google, and our overall goal is to look at how we use our Google products and services to help improve health outcomes.
Okay, now you said that you focus largely on YouTube. That's where your remit is. And of course, we're dealing there with, what is it, something like 500 hours of content uploaded every minute or something, which is mind-boggling in itself.
There are a lot of fascinating things about information on YouTube in terms of scale. So, 2 billion people, Hannah, use YouTube in a regular way in a month. And if you think about it, that's about somewhere about a third or so of the world's population. So a lot of folks globally around use YouTube to get information in a variety of different ways. And our goal is really around health information. How do we get quality health information to individuals? And we have a number of ways to do that. We work with partners around the world to help produce and make quality health information. So like, the NHS in the UK or Massachusetts General Hospital in the US and Cleveland Clinic and Mayo Clinic and all those other folks help get quality information. And we also recently have started labeling information from quality health sources so that people are able to understand that. So there's a number of different ways we work to try to get quality health information to individuals across the world.
Yeah, I mean, and that plays into what I was really kind of trying to get at with this question, which is with so much content there, how do you identify and highlight the real quality data?
Yes, exactly. So that's part of what our team does and so or works on. And so part of it is to have the production of quality health information so that it is visible and there on the platform. The other thing we do is what we've recently done that we announced about 2 or 3 months ago was this issue of shelves, of health shelves. And basically what it is that when you put in a search term in YouTube, you get a series of content that hopefully answers your questions. So if you ask about diabetes or hypertension, but that information is surfaced from quality health sources, whether they be hospitals or health agencies like the World Health Organization, NHS, or others, CDC, and others. And that's one new product feature that we have that tries to surface quality health information out of all the many potential content points you could get on YouTube.
Okay, understood. So then moving on then to data, and let's kick off with big data. What is it?
That's such a good question, Hannah. So, big data is something that is, I think, relatively new to science on a whole. And so it's, when you look at a variety of major data sources, so we look at tens and thousands or 100,000s of individuals, of a piece of information that may come from a variety of different data sources. And in the past, being able to analyze that has been problematic. But now, with machine learning and artificial intelligence and other kinds of digital ways, of digital analytic ways that have progressed over the years, we're now able to analyze big pieces of data for trends and understanding that hopefully can give better insight, as opposed to when you only had a couple hundred or even a couple thousand pieces of data in traditional research studies. So big data is just that. It's a lot of data, but then using a lot of discrete digital analytics to be able to find information from big data.
And customers, users should like or seek the benefit from big data because it just makes their experience all that more efficient.
Ooh, yeah, well, it is really a bunch of different ways. On the research end is where you see a lot more of the benefits of big data. So, for instance, some cancer researchers recently showed that by looking at large data sets of breast cancer images, they could pick up better better biomarkers that show risk factors or progression of breast cancer or risk factors for progression of breast cancer than you would with traditional analytic tools. This was some folks from Massachusetts General Hospital. So big data, really a lot of the benefit is in being able to do the research and understanding of disease entities and get conclusions from those research in general.
Okay, I want to ask also about data collection. Who does the data actually represent, and how do you sort of make it as diverse, equitable as possible when you're going about collecting?
Yeah, no, so that's one of the challenges, I would say, with how scientists. I think of myself as a researcher. I used to be a researcher before when I was in academics. So, that's one of the big challenges around science and research around big data is, when you analyze again all these large pieces of data sources, many times that may not capture the experiences and the clinical dynamics for underrepresented populations. So, one of the challenges with big data is how do you analyze subpopulations and other parts of data so that you capture the experiences, particularly of minority and underserved communities.
Okay, so you have a particular focus then on sort of marginalized communities and
yeah, exactly. Part of my kind of life's work kind of has been around this issue of marginalized communities, minority communities, and how do we meet their needs? And there's some benefits of big data, there's some challenges, and as a lot of things, it's really in how you engage the community with a lot of these kinds of efforts.
So looking then at cancer care from a global perspective, how do we include and elevate the voice of the community, the patients, the scientists, the specialists, so that we're all addressing community concerns?
Yeah, and this is again kind of going back to some of my earlier work, particularly when I was doing a lot more research. And this issue of patient-centered, the patient voice has been an ongoing challenge, I would say, not just for cancer. Heart disease is my area as well, but how you treat a lot of clinical challenges, especially clinical research. And really, the goal is always to engage patients in just even designing the research. How do you have what we call community-based participatory research to engage the community early on at all different stages of research development, question asking, and all of these different components. And that's one of the key factors to helping have the patient voice be present, through research and the data analysis.
And you mentioned earlier, Garth, about big data having its challenges, of course, and information more broadly having its challenges as well. But I'm wondering, how does it then benefit the cancer community in the long term, which is obviously what the focus of this particular summit is on?
Yeah. Very good question, Hannah. What big data allows you to do is to analyze trends that you may not have been able to see with smaller sources of data. So I gave the example before of how data analytics were used to improve breast cancer screening with big data, particularly in being able to identify some of those biomarkers. And there's other examples of that, of where you use large data sets to help identify some of those risk factors for cancer and cancer progression. So there's a lot of benefit, particularly in cancer, to do these large data analyses that can give you these trends and insights, and then apply it back to individual patients. But as with many things, again, you have to think through again how you get the patient voice and the community voice engaged as you think through a lot of these data analytics, so that gets represented throughout the process.
And just finally, Garth, the World Cancer Leaders Summit, obviously taking place in Geneva now, not in Boston. But I'm wondering what you, in your position at Google and at YouTube, what your hopes would be to come out of this particular summit, of a gathering of this kind of community at this level.
Yeah, we continue to see, I think, the challenges around a variety of different oncologic diagnoses, cancer in general around the world. And COVID, I think, has made that even more challenging. I think that, the kinds of things we think about now, I think about from my perspective is thinking how we empower patients with health information. So, the kinds of things that would lead to earlier screening and earlier diagnosis, and giving that patient voice, and giving the patients the power to live their healthiest lives. I think that's one opportunity. And then the second thing, to continue to think about is, again, how we use technology as a tool to advance cancer care and improve cancer care from, just the initial concern of a patient to diagnosis to treatment, to follow up and all of those things. So I think really thinking through where we are in 2021 with cancer care and how we can use all of our tools to benefit individual patients.
It's been wonderful to talk to you. Thank you for the insight as well. Dr. Garth Graham, we appreciate your time. Thank you.
Thanks, Hannah.
And I reiterate again my thanks to Dr. Graham there from Google Health. Now, all Summit content is available to watch on demand on the Summit platform. That's in the digital library. We are now going to take a short break. I will see you back at 3:40 Geneva time. That's 9:40 a.m. in Boston. See you soon.